Hello, welcome to Excel's new webinar. This is Joe Rule. I'm a partner at Excel Physical Therapy, and tonight we're joined by Dr. Nick Romansky, who's going to talk to us tonight about the difference between over-the-counter inserts or arch supports versus custom orthotics. Dr. Romansky is the founder of Healthmark Foot and Ankle Associates. Dr. Romansky is a contributing editor to the Podiatry Today magazine and lectures nationwide. He is a team podiatrist for the U.S. World Cup and national men's and women's soccer teams, design consultant to multiple shoe gear companies, and medical consultant to many of the Philadelphia's professional teams and the Professional Futsal League. So, Dr. Romansky, thank you for joining us tonight.
Thank you.
So, a lot of times we have patients that are referred from you or your associates, and they're coming in and they're starting physical therapy for an underlying foot condition, and they say they're having orthotics made. So can you describe what an orthotic is and its relationship to how it assists the patient in physical therapy?
Yeah, so let's go back to the beginning and the basic reason why they're coming to me or they're coming to you, whether directly from me to you or you to me. Basically, it's for a number of reasons that really, quite honestly, physical therapy is a natural complement to podiatry and surgery. So they work hand in hand with that. So in that sense, basically, when someone comes to me for a foot, ankle, or lower extremity problem, a lot of times just because we're seeing the pathology or the problem in the lower extremity or the foot and ankle, usually it's coming from somewhere else in addition to the foot and ankle. So again, we're looking at not just treating the problem, but we want to treat the cause. So most people want to treat the symptom, but really we're here to treat the cause. And that's where the physical therapist comes in with their knowledge in their hands to assist us in getting that patient back to full recovery in whatever activity they want to do. That said, usually with our patients who have some type of foot, ankle, and lower extremity abnormality, typically there's an underlying muscle weakness, there's usually some form of compensation, and there's usually some form of muscle imbalance. And that's where the physical therapy group comes in with the individuals from XLPT that actually can help assist us getting that patient better as a team player. Before we even look at orthotics and before we even look at, we really got to look at the foot is connected to the rest of the body. It's not really separate. And that's really critical, that really you have to look north or you have to look above the foot and ankle of what's going on really from the low back down or from the foot up to the low back.
So have you seen where there might be a weakness in a hip that will contribute to a foot and ankle pain and vice versa, where a foot and ankle problem can lead to hip pain?
Right, so that's where that muscle imbalance, that's compensation going on, or that weakness presents itself from whatever level it may be, whether it's the foot and ankle causing the hip issues or the hip issues actually causing the foot issues. So I think you have to look at it both ways, proximal or up above the ankle or distal below the hip or back toward the foot.
Got it.
It's all connected.
There was a course a number of years ago that I went to, and it was when the foot hits the ground, everything changes.
Yes, know it very well.
Yeah.
Another physical therapist who did that. Yep.
Yeah. So that's a great course, and to your point, where it's all interconnected. So you have muscle imbalances. So a physical therapist can help with muscle imbalances. So how about a foot problem? Is that what the orthotic is designed to help to do?
So let's start out by the basic definition of an orthotic. Okay, so it's usually a custom-made insert made a number of ways, from a scan, from a foam box, or I prefer still the original way of plaster cast impression. And that cast is sent to a lab, and a lab makes a custom device based on that patient's needs, okay? Based on what they're doing, their foot type, their body shape, their surface they walk or run on, and also their pathology. So it's a custom device for you that will fit in your sneaker or shoe of any type. But again, it's a little bit easier in men than women. But again, we look at multiple aspects to make the appropriate orthotic that's custom made for their needs. All right, so it's made out of multiple materials. Typically, it's full length in nature, but most typically, we really want to know what the need of that insert is. Not everybody needs an insert, even though some professionals believe that whether it's podiatry or other professions that everybody needs an insert. Not everybody needs an insert because the orthotic is only one piece of the pie, because physical therapy is a piece of the pie, weight control is a piece of the pie, proper training is a piece of the pie, orthotics is a piece of the pie, the actual shoe or sneaker is a piece of the pie. So it's a number of pieces of pie that make up the entire pie to make you get fit, get functional, and on your way without getting hurt. And so when you do have an injury, the biggest reason, in my opinion, is the biggest reason why you have re-injury is failure to rehab the first injury, failure to understand the first injury or the injury, failure to treat the cause, and most people treat the symptom. So again, we're looking at the cause here, and that's where that physical therapist comes in to evaluate, does a functional screen, just like a podiatrist would do a functional screen. We put our heads together and we formulate a plan, not just with inserts, but looking at the entire body based on what their needs are, again, involving the science and the art of both professions to get that person functional and fit again.
So we have a patient sent to us with, say, knee pain, and the orthotics are being made. What then? So the orthotic that you would recommend would be based on a long distance runner versus someone who's just going to be walking around the block or walking down to the store, or is that some of the factors that you use to determine what kind of orthotic?
Right. So some of the things we look at. So number one is if it's a knee issue. So truly, where is that knee issue? What is the cause of the knee pain? What is the cause of the ankle pain? What's the cause of the hip or back pain? So we look at the cause, do the appropriate test, and don't just assume a diagnosis that you saw on Dr. Google or Dr. Amazon. Okay? You need to make that. So many people come in to your facility, my facility, already knowing that they had this particular problem, and they've made the diagnosis already. And really, it's not the diagnosis. It's not the cause. And it's our job to educate them, inform them, and get the appropriate studies and evaluation that proves or disproves their predisposed thought process of a diagnosis. And it's a big problem now with social media that they do a lot of stuff online before they come in, and they already have this predisposed idea of a particular issue. So when talking specifically about a joint, whether it's in this particular case a knee, I always look one joint above and one joint below. Okay, so if it's the middle of a foot, I'm going to look further out towards the toes, and I'm going to look at an ankle. So I always look one joint above, one joint below, and see if there's any weakness, anything I can see that's obvious to me that has to do with evaluating that knee or that ankle or that body part. So based on that, when you're looking at orthotic, there are multiple decisions that have to be made of what type of insert you're going to make, what material will be used, what type of actual material. If it's going to be a composite material, it's going to be what we call a polypropylene, it's going to be a subortholine. There's many different materials based on what your needs are, what your pathology is, what surface you're running on, what shoe you're using, what particular activity you're doing, how much your weight is, or what your, all those little things go into making a custom insert, and then the lab will help you on the next level as well. And very importantly, that really you see some professionals, nationwide and locally, that a lot of times make the same insert or the same custom orthotic for everybody. Everybody gets the same thing, whether it's a podiatrist or another profession. They all want to get the same one, just for one size fits all or one type of orthotic fits all, which is very common mispractice and should not be practiced. It should be made for your needs, your shoe, your foot type, your sport-specific activity.
So that sounds a lot different than the thing that you would go into a pharmacy and step on, and it gives you a number for a shoe insert that you should go down to aisle 3. So can you, once you talk about those differences?
Right. So there are many people will go and try a variety of inserts or arch supports over the counter before they come to our office or they even come to your office. They've tried a bunch of remedies first. They've seen online, they've got from a friend, they've got from a local store, they've seen in a local store walking up and down the aisles. I have no problem with doing that because that really kind of helps me out what they purchased, what company and brand they purchased. And as a result, I can tell them that, this particular company was not good. It caused this and didn't cause this or help this. So I don't have a problem going with an over-the-counter one first and trying that. Most of the people come in have tried that, have tried something on their own. And that's one of the first questions I ask is, what have you tried yourself? So again, just like sneakers, when going to purchase sneakers, there's a lot of really good insoles out there, but it's nothing like a custom insert for your custom needs. And again, some of the over-the-counter ones will perform well, but again, replace them on a regular basis if they really work well for you. But you still may go on to a custom one, literally like it says, custom means made specifically for your needs, your abnormalities, your shoe type, your foot type.
So if someone, is it similar to like a running shoe? So 400?
Same idea. Exactly the same idea. So there's a lot of them up and down the big box stores, a lot of them in the specialty stores, a lot of them in online. Are they getting better now with the 3D ones that are not there yet? Are they getting better now with the custom ones with more bells and whistles, more things that you can add on there? Yes, but there's nothing like a custom one in my opinion.
Got it. So, and the individuality is what really, your ability to hone in on what's really going on makes it very specific for that individual person versus the over-the-counter one.
Right. Again, we're looking for, some of the over-the-counter ones work well for the masses, but sometimes you just need a custom insert for your individual needs and treating, again, the cause and not the symptoms.
So I've seen the orthotics are bulky, but how do you make it so that they fit into a smaller, say a dress shoe? A woman wants to wear a dress shoe, but wants the support of an orthotic. Are there orthotics that are lower profile that would fit into different shoes?
Yeah, so let's go back again to the over-the-counter OTC insert / arch support. So typically all an arch support does is bring the ground up to you, okay? Orthotic, okay, just think about it. The orthotic has more control, typically more control. Now, can you over-control somebody? Can you under-control somebody? Yes. So you want to keep someone with an orthotic, custom orthotic device somewhere around the normal range of motion of that joint, whether it's a knee, an ankle, what we call the subtalar joint, a big toe joint. So we don't want to lock it up. Yet again, we don't want to make it also very hypermobile. So we want to keep it in the normal range because you can create new problems if you under correct them or overcorrect them. So again, going back, the arch support of the over-counter insert is literally bringing out ground up you and typically does not control you. It just accommodates you, where the orthotic is more likely to control you and meet the needs of your abnormal dysfunction and alike. The other thing the orthotic is more likely to do, a hot word nowadays you hear so much about in professional sports is load management, okay? So you see a lot of these athletes now need to take a break. They have a night off or whatever. You're going to see your star on the court or on the field, and they're not playing that day because of load management. So there's the same thing. What does an orthotic do? Okay, it's about load management. Mechanically neutralizing the abnormal stresses that mom and dad made, okay, or you created from a previous injury.
Okay. So let's go back to there's a foot problem creating knee pain. So that helps to control the foot problem so the knee pain would be less.
Potentially, yes.
Okay.
Right.
So that's the control that you're talking about as far as what you're
right. So again, if that kneecap is not tracking correctly, that hip is not loading correctly, do you have a limb length discrepancy, one leg longer than the other? Is it structural versus functional? Is because you've adapted and one hip's a little higher or one side's a little tighter or a little bit more used or underused, or a little bit tighter versus stretched out. So again, you got to look at other factors, but ultimately the physical therapist will help us look at muscle weakness, muscle compensation with that knee pain, as we also look at it, above and below that that knee that may be dysfunctional, getting the appropriate tests.
So custom orthotics, custom made for you, help you meet the demands that you want to place on your body. Works very well in conjunction with physical therapy. Anything else that you want to say to add about orthotics?
I think yes. I think you can make an orthotic for anything. You can make it for a baseball cleat. You can make it for a women's dress shoe. Okay, and really, that's really one of the first questions you ask is, what are we treating? What are we using it for? And what type of shoe or sneaker or cleat are you using? And that really comes down to, because you can make an orthotic many different ways. There's many type of materials. The goal is again, as we've talked about in the past, it's about that interface of the shoe with the orthotic, the sneaker with the orthotic. If that interface doesn't work, that patient's either going to have more symptoms or does not get the original symptom under control and get less pain or less, dysfunction. So that the actual shoe that person is wearing, whether it's a women's dress shoe or a bulky men's shoe or a slip-on shoe or a slide or a loafer, is very critical. But you can make it to the shoe. Typically, most labs have the appropriate materials to make one as thin as 3 millimeters and something as thick as 6 millimeters. So wow. It doesn't have to be this bulky device that people had, back many years ago that their parents and grandparents have. It doesn't have to be that way. You can make them very thin as well as making them very functional to control your load management and control your symptoms.
It's interesting you say that. I remember having a patient that went in to see you and they brought in 2 or 3 different pair of shoes that they ordinarily would wear during the course of the day just to make sure that the orthotic would be the right one for the shoes that they wear often.
Right. So I typically, if I can get an insert to work in 85% of the shoes, then I'm happy with that. Now, sometimes if I get more than that, so I'm just trying to get it for the majority of the type of shoes they wear. Again, it's a little easier with men, but again, sometimes not, because they just stay with slip-ons or loafers. But basically, I try to go for 80 to 90% of the typical shoe that they would wear every day, whether it's for activity or work. I want to try to wear as much as I can. That doesn't take away the importance of also doing therapy with and without sneakers on or without shoes on, where we don't want the orthotic to become, you're totally dependent on it, where you're actually creating some new issues with that. So I use it wisely in my office, in my practice, in my thought process, that you can wear it up to 80 and 90% of the time. Some people can't go without them, myself included, for 30-something years for a knee problem. There's other people that can just use them just for sports, but again, you're making it for what their needs are, whether it's a particular sport or they're standing on concrete as a warehouseman or a warehouse person.
Right. And what's the turnaround time when someone is in your office getting fitted for the I would imagine the slipper cast? You said that's what you use?
Right. Yeah, so it all depends on the lab we use. There's different fees if you have to rush it or not, but it all depends on the lab. We use multiple labs based on what the patient's needs are. But, I don't want to put a specific time on it, but we can do a turnaround time very quickly. And I want to say from 2 to 5 days to 2 weeks. It all depends on, the lab is closed or there's a holiday or there's a shipping issue or there's a, epidemic or whatever.
Pandemic.
But really, typically, we can turn around as quick as that person needs it because they're going back to college or going to, a particular school. They have to go away and they're leaving the country or whatever. We can turn it around as quick as we can, make it, and then we can do it based on their needs. So awesome. It varies in time.
Yeah, great. So Dr. Romansky, thank you very much for joining us today. Excel Physical Therapy has 32 clinics in the Delaware Valley. Physical therapists are specialists in the treatment of musculoskeletal conditions to alleviate pain and assist our patients to return to function. Together with physicians like Dr. Romansky, we help people return to things they love to do based on their individual goals. Function is different for everyone. It could be running the Broad Street or walking down a driveway to get the newspaper. For more information about how the physical therapists at Excel Physical Therapy can help you, please call us at 866-883-9235 or visit us at excelphysicaltherapy.com. For more information on Dr. Romansky and how you could see him, please call his office at 610-565-3668 or visit hmfaa.org for more information. Thanks again, Dr. Romansky, and until our next webinar, be safe and keep moving.
Thank you.